That's fine.
All right. Hello, my name is Jasmine. I'm gonna be your nurse today. I'm gonna go ahead and do my physical assessment. Are you comfortable? Do you need to go to the restroom or anything? All right. Sounds good. I'm gonna start off by looking at your scalp. Do you feel any lumps or tenderness or pain?
No.
All right. Everything is symmetrical with your face. Everything is midline. All right. We'll go ahead and do your temporal artery. Both of those sound good. Feel good. All right. Let's do your if you can open and close your mouth for me. Do it again. All right. So everything's good right there. Okay. Can you clench your teeth for me and hold against resistance? Okay. Good. Now I'm gonna take this cotton swab and you tell me when you can start feeling it.
Yes.
Okay. Sounds good. So everything is good right there. Can you smile for me? Can you frown? Can you close your eyes tightly? Alrighty. Can you lift your eyebrows? Can you show your teeth? And can you puff your cheeks for me? So everything is intact there. Good job. Alright, now we're going to do our visual acuity test. So I'm going to get my chart. Let's see. If you can just stand right here. Yeah, you stand right there. This should be a good 10 feet.
Okay. You let me receive.
Good. Let's see.
Like, hang it right here?
Yeah, we can hang it right there.
Okay.
Alright, and you go back towards the camera. Alright, tell me the lowest line that you can read. Do you got contacts or eyeglasses?
Contacts.
You do got contacts?
Mhm.
Okay. You want to do the exam with your contacts on?
Yes.
Okay. Alright, tell me the lowest line that you can see clearly.
The bottom one is LEFODPCT.
Okay. Can you cover your left eye for me?
Okay.
And then do the same thing?
LEFODPCT.
Alright, you cover your other eye for me.
LEFODPCT.
Perfect. Alright, so your vision is 20/20 at 10 feet away. You can have a seat for me. So everything's good in that area. Alright, now we're going to do your visual fields. So here's my finger and I'm going to go out and you just follow it, okay? Good. Alright, I'm going to take this pen light and I'm going to take a look at your eyes. So you just look at me. Good. Everything's good in there. Perla. Take size for accommodation. Can you tell me when you can see my finger?
I can see it. Yes.
Okay. Sounds good. Alright, and just palpate your eye structures. No swelling. Are there any pain around your eyelids?
No.
Okay, sounds good. And I'm just looking at your sclera too. Everything is white. I don't see any mucus or discharge. Alright, and take a look at your ears. Can you hold your hair back for me? Good. It's symmetrical. Any pain or tenderness in that area?
No.
Alright, and now we're going to do the whisper test. So I'm going to cover this ear and I'm going to whisper something and you repeat it to me, okay?
Okay. Hair. Makeup.
Okay, sounds good. Everything's good over there. Alright, let me just take a look at your nose. Symmetrical. Can you cover one nostril and blow out for me? Alright, and cover the other nostril and blow out for me. Okay. Everything sounds good right there. Let me take a look at it. Alright, I don't see any occlusions or anything. Any pain or tenderness in your nose area?
No.
Alright. Look at your sinuses. Do you have any pain or tenderness in that area?
No.
Alright. So I think we're good on that. Look at your mouth. Pink and moist. You see your teeth? It's like all your teeth are there. You can hold your tongue out for me. Okay, it's symmetrical. Sounds good. And then look at your tonsils. Have you got your tonsils taken out?
Yes.
Okay. And I'm gonna have you say all for me.
Ah.
your gag reflex? Okay. I think we can get in there, yeah. Alright. We did that. Okay. That's good. Now I'm going to take a look at your neck. And then we're going to feel all your lymph nodes. Have you been feeling sick or anything?
No.
I don't feel any swollen lymph nodes or anything. Okay, so I think we're good there. Alright, now we're going to test your range of motion. Can you touch your chin to your chest? Okay. Can you move your head side to side for me? Can you touch your ear to your shoulder? Yeah. And extend your head backwards. Perfect. Alright, now I want to assess muscle strength against resistance. So I'm going to have you turn your head to each side. Yeah, this is down. I'm going to do the other one. And show your shoulders. Okay. Okay. It says turn head to each side and one person shoulder. So I guess it's okay. Okay. We're good in that one. Alright, I'm gonna look at your trachea. No, neck up on me. Trachea is midline. Alright. And then we're gonna take a look at your thyroid. And we got our cup of water. So if you'll swallow that water for me. Okay. Everything's good right there. Sounds good to me. Alright, I'm gonna palpate your carotid. Alright, no bruising thing. Alright, and then the chest wall. And you said that's not like a tank top or anything, is it? You can just unzip it.
Okay.
And then I can just, yeah.
You want me to lay down?
Yes, you go ahead like that.
Okay.
And move this up out of the way. Alrighty. So looking at your chest. Any pain or tenderness in any of those areas?
Oh.
Okay, everything's fine there. Alright. And then the tactile primitus. Sit up with me. Don't do that. And symmetric expansion.
Do I need to take this off?
No, I
The
think
jacket?
it'll be fine. Yeah, I can feel it through it, I think.
Okay.
Alright. And I'm gonna just watch you breathe and make sure you.
Okay.
Okay. So no hard work or breathing or anything. Alright. And can you say 99 for me?
99.
Okay.
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 99. 99.
Alright. All that sounds good. And we're gonna do your posterior lung fields. You can leave that on. Okay. And just have you breathe in each time, okay?
Okay.
Again. Everything sounded clear. I didn't hear any abnormal signs. Alright. Percuss coastal verbal angle for flank pain. Do you feel any flank pain right there?
No.
Okay. Alright. And then I also got to percuss all of your areas. see. You can see the sounds over here too. Sounds good. We got all of that. Alright, while you are doing that, I think I'm gonna go ahead and listen to your heart sounds since we're already in this area. I just listened to the heart sound in all areas. Everything sounded good. No brood or anything like that. We already talked about your work of breathing. You're not working too hard to breathe. Everything is fine there. Listen to the aortic, pulmonic, mitral, and tricuspid areas. Let me use the diaphragm now. Sounds good. Alright, let's go ahead and go to your abdomen, and everything looks good in your abdomen. I don't see any lines indicating that you've had like any surgeries or anything. You haven't had any C-sections or anything like that? Okay, sounds good. It's symmetrical. I don't see any visible issues or any obstructions or anything like that. You don't have any contour hernias around your umbilicus. Now listen to your bowel sounds. They're all normal active. I'm gonna do a light palpation. Do you feel any pain with that?
No, ma'am.
Alright, and I'm doing deep palpation with it.
No.
Now I'm trying to feel for your liver. Okay, so I just palpated for the liver. Alrighty, get the bowel sounds. Light palpation, percussion. Everything sounds good in that area. Alright, now we're gonna go to some movements. So if you like, you can go ahead and sit back up for me. Okay. We're gonna look at your upper extremities.
Leave it on.
Yeah. And just look at your arms. I'll get your thing off.
Okay.
I feel like you could cover it.
Okay. I'm gonna cover this.
Yeah. Look at your arms. Everything's symmetrical. Everything looks fine there. Alright. I'm gonna palpate your radial, brachial, and ulnar arteries. So we'll do your brachial first. Okay.
Just stop it.
Let me stop it. Okay, so I just did all her arteries and those all felt fine. Capillary refill. Okay, good. Capillary refill less than 3 seconds. Let's do range of motion. Alright, now we're going to test your range of motion. So if you could forward flex your arms above your head. Alrighty. Hyperextend your arms behind your back. And then abduct and adduct your arms. So take them away from you and bring them back. Perfect. Alright, we're going to have you passively flex and extend your arm. So yeah, flex and extend them for me. That looks good. Alrighty. Then I'm going to have you pronate and supinate. So turn them, yeah. That looks good there. And I'm going to have you flex and extend your elbow against resistance, okay? So, yeah. Strength is good. Now we're going to do the range of motion of your wrist, your hands, and your fingers. So I'm going to have you flex and extend your wrist. So just, yeah. That looks good right there. Make a fist, spread, and close fingers, and then touch thumb to each finger. Perfect. All right. That all looks good. Now, we're going to do the finger to nose test. So if you could bring your finger to your nose. Good job. And do the other one. Good job. Alright, then now we're going to test your reflexes. Alright, so just hang on up with me. Triceps, biceps, and the brachial. Let's do the other side again. Okay, sounds good. And now we're going to do the graphesthesia. So if you close your eyes and hold your hand out for me. And what did I just make?
See, girl?
Yeah. And then we'll do this one. Yep. Alright, I'm going to put an object in your hand. Can you tell me what that is?
A Sharpie?
Yep. And then I got another item to put in your hand.
An AirPod?
Yep. Thank
Mine?
you.
It's yours.
Thank you, ma'am. Alright, we've already done the chest and the abdomen. So we got that part out the way already. Alright. Now we're going to take a look at your lower extremities. So, yeah, you can lay that one.
You want me to roll up my,
Yeah, just roll them up as far as you can go.
Okay. I should put on my shorts. Look, I already put a hole in them. Let's see. Alright, is that good?
That should be good. Alright. So I'm looking at it and everything looks good. Everything is symmetrical. I don't see any bruising, anything like that. I don't see any swelling in your feet. I'm going to go ahead and do your pulses. Good. That's good. I've never been able to feel nobody this good. 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 I'm gonna see a proper too. Perfect. Alright. All of those are good. Like I said, you don't have any edema down there. We're gonna test the range of motion of your bilateral hip, leg, and knee. So it wants you to raise your leg 90 degrees. Alright. And then bend knee up to your chest.
Okay.
Good. Now rotate your hips by pointing knees in and out. Okay. Sounds good. And then adduct and abduct your leg. So, take them away from you. Yep, and bring them back. Okay. That's good right there. Alright, we're going to do your reflexes. So we're going to do the patellar, Achilles, and the Babinski reflexes.
I'll put these back down. Oh my gosh. Alright, my legs over the edge.
Okay. Make sure the camera can see it.
Oh my gosh. Sorry.
Are you fine?
I'm struggling. I might need some assistance. There we go. I got it. Okay. All right.
Okay. Patellar reflex.
I think it's below.
Oh.
Wait, one more time.
Okay. Okay, and your Achilles. Okay, the bits. Sounds good. Everything is intact. Alright. Now while you're still lying, you can run your heel down your left shin. And then do the opposite. Okay. Sounds good. Let's make sure we got everything in that area. Yeah. Alright. Sounds good. Now I'm going to have you stand up for me. Okay. Make sure that the video can see it. Okay. Now I'm going to have you come from here and walk on your heels for me.
Okay.
Alright, perfect. Now walk on your toes. Perfect. Now we're going to do the Romberg test. So if you could just stand and close your eyes for me. Okay, no swing. That's good. Alright, we're going to assess muscle strength and cerebral function. So I'm going to have you to hop on one leg. Alright. Then hop on your other one for me. Perfect. And I'm going to look at your spine.
Okay.
Alright, everything seems to be midline. You never been diagnosed with scoliosis or anything like that.
No, ma'am.
And then you already bend forward and touch your toes. Bend sideways.
Okay.
Bend backwards. And then twist for me. Perfect. Alright. Oh, you got one more. So shoulders each side. You did that. Alrighty. So everything is looking good. Now, alrighty. So according to your history, you have everything was normal with you, but you have a family history of pre-diabetes and diabetes. So I got a little pamphlet for you that I'm going to go over the information. So tell me what you know about diabetes.
Not very much.
Not very much. A lot of people have the misconception that diabetes just means that a person who eats a whole lot of sugar. So they'll be thinking, oh, that person only got it because they ate a whole cake or something. That's not necessarily how it works. There are different types of diabetes, but the one we're focused on is type 2 diabetes. So it's not necessarily that the blood sugar is high. It is high, but your body is supposed to create insulin to lower these levels. Your body doesn't necessarily create the insulin like it should, or it's not using the insulin correctly. So that's why we have diabetes. So what is prediabetes? A condition where blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. So we have somebody whose blood sugar is normal, then we have a diabetic person, then we have the prediabetes because they're in the middle. You diagnose prediabetes and diabetes with an A1C. You want your A1C to be less than 5.7%, But if it is between 5.7% and 6.4%, that means that you have prediabetes. And what exactly is the A1C? The A1C test measures your blood sugar over the past 2 to 3 months. So even if you were to go and like eat a whole lot of sweets before your test, your test results are still going to be the same as if you didn't do that, because it's measuring over a long period of time. It's different from pricking your finger, where if you were to eat a whole lot of sugar, it would be high, because that's a right now answer. Patients that are diagnosed with prediabetes are done so by the hemoglobin A1C test. This test measures blood sugar level over the past 2 to 3 months. No fasting is needed prior to the test, so you can eat as normal whenever you go do your test. What are the signs and symptoms of prediabetes? So we have increased thirst, frequent urination, and you have the frequent urination because your body has all this sugar built up, and then the insulin's not being created, so it's just trying to dump all this sugar out any way it can. And that's why sometimes when a diabetic person or pre-diabetic person, you'll find glucose in their urine. So you might find yourself more thirsty, you might find yourself more hungry, you might be tired all the time, blurred vision, small skin growths like little skin tags or something that weren't there before, and you may even have some numbness or tingling in your hands or feet. Have you had any of that, or know any family members that's had some of those things?
Some family members.
And as you know, I'm sure you've had some family members that's had to have like amputations and stuff, because it can cause slow healing. So if they, say for instance, step on like a Lego or something, now they got a hole in their foot, and it doesn't heal the same way that everybody else's does. So they end up getting it cut off because it's just not going to get any better. And the higher your blood sugar is, the worse the healing is going to be. That's why it's really important to do like inspections on your feet, especially when you're having this numbness. You don't know if you stepped on something, or you don't know if a surface is too hot. So make sure you just looking at your feet, every now and then, or if you feel something, like some people might see some blood on their sock and they're like, where did it come from? They didn't even know they stepped on something because they have diabetes. What can you do to prevent diabetes or prediabetes? You can exercise, of course, diet changes and weight loss, medication like metformin. They'll even give that with prediabetes, and of course they'll give the insulins and all that for diabetes. But medication wise, they don't really give you a whole lot of medication for prediabetes because they want you to handle it before you get to that point. So they're pretty much just banking on you exercising and losing the weight that you need, because for some reason it's just really hard to maintain a good blood sugar, or for your body to produce the insulin like it should whenever you have too much weight on you. Also, stopping smoking will help with preventing you to get diabetes, and that's a risk factor of getting diabetes. So all these preventable things are your risk factors. Having like a stagnant lifestyle where you're just sitting around all day, that doesn't help. So try to exercise and get out of there, and that'll help significantly reduce your chances of getting it. Do I need to check my blood sugar with prediabetes? If indicated by your healthcare provider, blood sugar checks should be performed. So if your provider is thinking that this is just something that's kind of getting out of hand, they probably will have you check your blood sugar. But a lot of pre-diabetics don't really check their blood sugar. They're just trying to go ahead and do the exercise and the diet changes and the weight loss. These are usually performed prior to meal times. Insulin administration is usually not indicated unless the diagnosis of diabetes has been made. Because like I said, at this point, we're still trying to prevent diabetes from happening. Pre-diabetes is reversible, but it takes some hard work and some hard dedication. Do you have any questions about that?
I do not. That was great information.
All right. Thank you, ma'am.
Thank you.